You are now listening to Nailed It, the Orthopedic Surgery Podcast.
So, all right, so I guess we can move on and we can talk about, I guess, different structures, what it looks like normally, and then what it looks like when there's injury. And, one of the big things that we all, at least as a med student, they used to ask me all the time are, looking at menisci and seeing where the tear is. So can you kind of go through what a normal meniscus should look like on an MRI?
Absolutely. Yeah. So I think the first sequence that I tend to look for when I'm thinking meniscus injury is I'll go to the sagittal image first, just because that's your expectation of kind of that bow tie appearance, going in and seeing the black triangle on the front and the black triangle on the back, right? So you see, again, it's black on both that T1 image you're pointing to, as well as the T2 image bottom left. So you should see thick black, no significant signal change within it, but we'll get into what detects or what defines a tear versus normal signal. But largely speaking, black thick triangles. And as you get more towards the periphery, where you get towards the back of the C shape, those triangles will coalesce, and that's where you get your kind of bow tie appearance. If you see too much of where those triangles are attached, that's your discoid meniscus. If you think three-dimensionally with a C on its side, where you're cutting slices, there should only be a small portion of where that those slices still intersect with one another before they come out to the extensions of the C, if you will. And so if you think about having more of that C be like a D, you're going to have more of those slices where they're connecting. So three contiguous sagittal sequences where they're connecting is indicative of a discoid meniscus. Go ahead.
No, I was gonna say, so that'd be like this picture down here in the middle. We could tell this is more towards the periphery because you can kind of see some of the continuation of the black. But if we saw this on three different images, we'd know, this is like, that's a discoid meniscus per se.
That's right. And again, things to say on that picture you're showing, you're more peripheral by seeing that fibula sneaking in on the bottom. And so that also guides you to say, all right, if I've got this one image, where am I in space? You're peripheral because those triangles are getting ready to touch. You're peripheral because the fibula is sneaking in, and you're lateral because you're at the location of the fibula, in addition to kind of that convexity of the tibia here instead of the concave nature, more so of the medial side. So all of those are going to clue you in to say, where am I in space? Because on a sagittal single image, sometimes it's hard to tell.
Yeah. And I think you just touched on all this, best seen on sagittal images. I know, I read and they'll say, you should at least see, when you're looking at different tears, you should at least see that, that increased signal intensity, I guess, on two different images per se, in order to call it, I guess, a meniscus tear.
Correct.